comes up at 9:30 right here on KUM.
Wait, what?
Tom Brady plays for who?
Tampa Bay.
Tampa Bay.
I know.
Wow.
He went down with the and so okay.
Just can't get rid of the guy.
Okay, now you know Doc is a big football fan, so Joseph, you want to bring him up? So we were trying to do something at KUM, and we always do this. We say, what 4 teams that are in the conference championships can we do something with the food of that region? So obviously Green Bay, you've got cheese. Kansas City, you've got barbecue.
Yep.
Uh,
Tampa Bay is what?
Tampa Bay is
Seafood.
death metal, maybe.
I'm guessing seafood.
Yeah, we were trying to figure, and you know, of course, Buffalo. You got Buffalo wings.
Right.
Yeah, if any of you guys are from Doc, would you even know about the cuisine of Tampa, of that part of Florida?
Not at all.
Yeah. You know, us Jaguars, we have the weirdest reasons why we root for a team. Like, Doc, can you tell us why do you root for the Tampa Bay Buccaneers? Because I've never met a Tampa Bay fan before.
There are many.
Well, yeah, now that Tom Brady's with us.
Fan, in general, but I'm a Tom Brady fan, so that's what it is.
There you go. So he's one of these guys who follows Tom Brady. Like Andy, is Andy now a Tampa Bay fan or still Patriots?
He's kind of, his heart's still in New Hampshire where he's from, but you know, he follows Brady, you know, to the ends of the earth.
Right on. So there you go. Tampa Bay in the Battle of the Bays right now beating Green Bay.
Yep, by a touchdown.
By a touchdown.
And if you're wondering, the Kansas City Chiefs, defending world champs, are favored over the upstart Buffalo Bills by a field goal. So that's what the experts in Vegas are saying.
Wow, and we're going to be doing a whole bunch of stuff with the big game coming up here on the stations at KUAM. So keep it where you got it at 7 o'clock. Let's get into official business now, if you will, with the Chief Medical Officer from the Department of Public Health and Social Services, Dr. Felix Cabrera. Good morning, Doc.
Good morning, Chris. Good morning, Bree. Good morning, Jason.
I'm sorry, the comments, seafood and Cuban cuisine for Tampa Bay, guys.
Ah, okay.
To get you a nice Cubano or something.
Oh, that'd be good.
Right? Sounds great. Doc, okay, so we had a weekend here, 0 positives both days. I was joking with Sabrina that we only release results on the weekend if it's zeros. You know me, Mr. Sarcastic. But, yeah, how do you make of those results, Doc?
Well, you know, again, the results that are released over the weekend are only partial results. So those are that were done through public health labs. You know, Monday is usually when we get the rest of the information from like DLS and the hospitals and in terms of their results. And so that's why Mondays there always is a little uptick. It seems like just like last week, it was 3-day weekend. So that Tuesday, all of a sudden there's 30 cases and people were freaking out. But that was, you know, over 1,000 tests that were done. And so that was pretty consistent with where we had been. And, you know, last week we were averaging around 10 new cases per day. And we're doing a lot better than that now. We're actually, as of today, we're averaging about 6.1 new cases per day over a 7-day rolling average. So that's pretty good. Much better when it was 128 new cases per day back in November. So.
Mm-hmm. Well, one thing I noticed while I was away is the fact that public health has really started ramping up vaccinations and offering it at different locations. So if you could just run through where all these different, I guess there's clinics now, private clinics aside from AMC, and also pharmacies.
Yep. And so, you know, this has been, you know, what we've been hoping for, to get to this point where there's been, you know, we have the ability to now, decentralize a lot of the vaccination process. And so that really was happening early with partnership with GMH, with partnership with GRMC. And so that was incredible, where we were having 4 sites going on at the same time with mass vaccinations. And then now you get a little bit more of more intimate vaccination, experiences with several of the clinics coming online, you know, having met the CDC requirements to be able to give these vaccines. So it's very good. So at least from what I understand right now, it's AMC, SDA clinic has gotten some doses. Rexall Drugs is the first pharmacy to come online. And then Hagatnya Med, and then IHP and Tumon Medical Office, and then FHP as well got some doses that were distributed. So In those particular clinics, if you're a member of that clinic, if you go there regularly, just call and you can inquire about about getting the vaccine. But typically, what they're doing is that they're doing it for patients that are already scheduled for their routine health maintenance visits, like their annual exam, for example. And so then that's when they're administering it to them. And again, staying within the guidelines of what the eligibility criteria is as of today.
So you can't just go, you have to still fit that, like for example, we're doing priority group 1C. Do you have to be 60 years of age and older to go and get get the vaccines currently?
Correct. Yes, that is right now. Now the VA PPC, which is the committee that sets these priorities for the vaccines, have made that determination. And last week there was the addition of the school-based staff to start being included into the eligibility criteria. So this, and just so we're aware, school-based staff is actually a 1B. You said so. There's a group of other 1B areas that we haven't greenlit yet because there was some more concern about there's certain people in the 1C that we really had to get vaccinated and give them the opportunity, and that was the 60 years and older. So breaking from just the 75 and above.
All right. So private clinics, Rexall drugs. Again, if I'm either in 1B or 1C, those are the only people that can go and get the vaccine.
Yeah.
Okay.
If you're there for each clinic's gonna come up with their own way of distributing, and so they may have certain patients that are high risk that are already 60 and over, and they may prioritize them, and they may call them in, for example. So we leave it up to the clinics to decide what is best to give the vaccines in the most efficient way and get the most out of it for these early doses that are given to them.
Is this Moderna?
Within the criteria.
Is this Moderna or Pfizer?
So primarily it's Moderna because of it's easier for them
freezing.
to store and to handle, of course. So they've been given the Moderna vaccine.
Now, is it free?
Yes, absolutely. So again, the vaccines are you should never have to pay out of pocket for these vaccines at all. And so the vaccine itself is provided free from the federal government. Now, if you have insurance, the clinics or whoever, public health, even they have the opportunity to charge your clinic if you do have, charge your insurance if you do have insurance just for the administration fee, and we're talking about like $7, $15, something like that. But again, $0 out of your pocket.
Okay, so you might anticipate administrative costs. Clear, right?
Yeah, but that's on the back end. So the patients themselves should not have to worry about any of that, and that's just something that's between the clinics and the insurance.
There was a call?
Yeah, Doc, we had a call from someone who wanted to know if Category 1B included administrators and staff for GDOE or just schools in general.
So we say school-based staff. So if you are based in the school, if your office is within the school and you're required to be there for in-person teaching, then you qualify at that point. So if you're somebody that's on a more administrative in a central fashion and not actually school-based in the schools, then you're not yet eligible.
Okay. Can we go over the
Quarantine?
Yeah. And what is the latest with quarantine?
Sorry. Before we leave vaccines, I just want to make I want to share something that I only did the calculations this morning, and so we've been focusing on the 75 and older, right? I mean, that's been the first group that we wanted. They're 1A, and they're the one, along with the healthcare workers and long-term care facility residents. Out of in Guam right now, there's estimated of about 6,500 persons that are 75 years and older, and so far, getting at least the first dose of the vaccine, there's been about 5,300 that have gotten at least the first dose. That's 82%. That's amazing. I was shocked when I saw that number. And we're talking about just almost just less than 2 weeks ago, that number was actually, we're only at like 28%. And so at 82% of the 75 and older, that's amazing. And then already we're talking 28% of them already gotten the second dose. And then of course that will move as the time moves forward. But that's an amazing stat, and I think that we should be very proud, and we're really glad that the Manamco are really taking to heart how important this vaccine is and how important it is to save their lives. Mm-hmm. But for the 60 and over, 60 to 74 crowd, we're talking about more of a 17% penetration rate. But again, there's over 19,000 persons that are between 60 and 74 years old, and then we've given first dose to them about 3,200, and so that's where we're getting the 17% there. So there's still a lot of people left to vaccinate in that age group, and these numbers are as of the 23rd, so as of Friday.
What about homebound vaccinations?
Yeah. So that's ongoing. So it's ongoing with different ways to actually reach out. So one is, we know that HSP has been doing that for their own patients that are homebound, but then public health themselves are actually the nursing staff have a homebound plan to go out to the homes and this is in partnership, of course, with the mayor's office. And then AMC themselves have been taking upon themselves to volunteer and go out and working with different mayors as well for certain villages, and so they've been doing that as of this weekend even. So I think it's great that we're getting to these patients. In particular, some of these homebound persons were very brave that came out for their first dose. And it took so much for them, but they just absolutely can't do it again. And so they tried to register for the homebound. So they are also the priority in trying to get to.
Mm-hmm. What about the renal care centers? Have vaccinations began there? I don't see them on the list.
Yeah, I don't have that information in front of me right now, and so I don't know if they've technically started giving the vaccines yet. Mm-hmm. Sorry.
They would be on the list, though, right? If they began, okay.
Absolutely, yeah.
Okay.
Yeah. And then also, I just want to make sure that everyone's aware that starting tomorrow, so not only we're doing more vaccination opportunities in all these different clinics, but the mass vaccinations are actually shifting in a different opportunity, in that the National Guard now is operating vaccine clinics at UOG starting tomorrow. And it's from 2 p.m. to 8 p.m.
Yeah.
So if you work during the day, now you don't have an excuse. You can get it after work. And so that's great. And the best thing about it is that you can actually register online for an appointment, so to speak. And so, but the appointments are 1 hour blocks. And so there's a certain amount allotted per 1 hour. And then you just go on, it's an Eventbrite link. And in fact, I'll share that because so basically it's tinyurl.com/vaccinateGU. And so you go on that and it's Eventbrite. You just sign up for the 1 hour block that you want to go to. And right now it's scheduled from tomorrow onto a Saturday from 2 p.m. to 8 p.m. And you come in during your hour. If you come in a little bit early and there's spots available, they'll take you right away. And so if you come a little bit late, you may just have to wait a little bit, and then they'll get to you. And so the main goal is to not turn anybody away. And if you the focus is on the 60 years and older. But really, if you're a healthcare worker that's due for your second dose or finally coming around to wanting to get it, you can go to this. You can go to UOG tomorrow or throughout this week. If you're if you're a GDOE staff or school-based staff, you're actually you have a more dedicated vaccination opportunity at GRMC, which is today and tomorrow, and for school-based staff, where the focus is them. But if you are not able to get to one of those today or tomorrow, you have the opportunities throughout the week as well. So plenty of opportunities. We're really opening up the lanes here so that people can really get the vaccine at this time. Now, the other part here is that with all these efforts, if you actually count how many shots we've given per capita, never mind the first dose, second dose, just how many shots we've given per capita, never mind what's been allotted to us, the Mariana Islands overall is leading the country. The CNMI is number one. We are Guam and Alaska are actually 1 and 2, 2 and 3 right now, and so we're doing great when you look at our population and how much we've been able to vaccinate. So we should be very proud of that, and we're only expanding further. So we're basically trying to make the strong argument to the rest of the federal government: give us vaccines. We are good at giving vaccines. Give us more. We will achieve herd immunity much faster than everywhere else. And so we're making that argument by the speed that we're vaccinating. So we should all be very proud of, not just public health, but the whole entire island and everybody's willingness to get vaccinated.
Doc, can you clarify something? You keep mentioning GDOE and on-site staff being able to get vaccinated. Does this include private schools?
Yes, absolutely.
Okay.
School-based staff. So
Okay.
so I say GDOE just because they're the bigger, but then overall it is private schools, so it doesn't matter. You can be private, you can be public, and so basically, and the focus is on primary and secondary education, and also childcare. That's one thing that is not really hasn't been cleared enough, is that if you work in childcare, then you also are considered a school-based staff and you are eligible to get vaccinated.
Mm-hmm. When the 1C, 60 years of age and older, and even maybe 1A, the 75 years and older, if they have caregivers, are they able to get vaccinated?
Yeah.
Even if they're not. Go ahead.
Oh yeah. So what we're basically considering the caregivers for those who are homebound, and we're talking about really homebound, right? And homebound in that they can't take care of themselves completely. They can't do their activities of daily livings on their own. They need assistance from a primary caregiver. That primary caregiver, we're considering them actually essentially a 1A healthcare worker at this point. And we're trying to protect that elder. And so therefore we need to protect them by also protecting the primary caregiver.
Okay.
Regardless of their age.
The CDC guidelines in effect January 26th. I'm not sure if that's Guam time tomorrow or we have to wait till Wednesday with the rest of the country. That's still on target to be implemented, correct?
For the requiring PCR?
Yeah, 3 days prior to arrival and then after.
And what's the great thing here is that the onus is on the airlines to enforce that. So any of the international flights that arrive into Guam, the airlines are not supposed to have them board if they don't have that negative test within 72 hours. So that's what's the good part. But again, we already have a much more stringent quarantine process at this point, where we actually require the government-based quarantine at the quarantine facility. So that by itself is more, of course, protective. We are not requiring the 72-hour test coming from those flying domestically at this time. Unless you're somebody who's an essential staff and going on restriction of movement, then yes, you have to have that before you arrive. But right now it is, of course, the quarantine with the ability to test and transition to home quarantine after the day 6.
What if I go to like Japan, Singapore, or wherever for a couple of days or a week, and I come home? Do I need to get the PCR test?
Yes, you do.
You still
because
okay.
you'll be traveling from international.
Okay,
even though they're doing an excellent job controlling, but it's still it's a CDC requirement.
Mm-hmm.
Federal requirement.
And is that in effect tomorrow for Guam, or is it going to be Wednesday with everybody else, the rest of the country?
It's the 26th, and so I assume that we do it on our calendar as well.
Okay.
So, yeah.
Any changes to quarantine, or anything new with quarantine?
No, not at this time. Nothing to report. Only saying that more than ever is quarantine more important now with these new strains that are out there. Mm-hmm. And I can't emphasize that any more than I am right now. and that we thought that maybe quarantine was a little bit, there's some arguments about it being, too restrictive and it was too much. Right now, the way it is, this is the only thing that's protecting us from the new strains. And we know that this is successful because look at the CNMI, for example. Our quarantine right now is very similar to the CNMI, and the CNMI has not had any community spread in, I can't even remember when, months and months, right? And so anytime they get a positive, it's because they're catching it within quarantine. And so this is extremely, extremely important. What we're finding more is that, yes, these strains from the UK and from South Africa and Brazil, that they're more infectious, right? There's a new study that shows that I think the one from UK might even start showing that it might make you more sick as well. Now, we thought it was just more infectious, and we know that, but there is some that may actually some strains that may actually make you more sick, and so more reason to be a whole lot worried.
And in terms of the vaccine, there's still nothing to show that even if you did get the vaccine, it would prevent you from or protect you from this new strain.
So far, what the studies are showing us is that it should protect us from these strains, the vaccine, which is very important.
I did want to go back to the education vaccines for education personnel. Does that include Dodea?
No, they have their own. So they're under Department of Defense, so they have their own, and they've been getting their vaccines already, as I understand. So that's to the Department of Defense allotment, not our local allotment. Okay. And then, by the way, the numbers you're seeing, that we're reporting, that's the civilian numbers. We're not even reporting the Department of Defense numbers. And so, but overall, when we are looking at it on the side in terms of overall herd immunity for the island and how we're scaling up toward that.
There was something that Dr. Ann had mentioned last week regarding was it military personnel that were coming in?
Yeah. There was I think there were some positives with the DOD, and I'm not sure if these were people who are coming in for the Operation Sea Dragon, but she said that they were positive and that it was over on the DOD side. So,
but they're included in our numbers,
right?
Well, for the cases, absolutely, we always include cases, in our numbers overall.
Were they part of Operation Sea Dragon? Do you know?
I have no idea.
Okay, because when you read the release from the military about Operation Sea Dragon, they had strict protocols about testing before you leave, testing when you get here, and then the restriction of movement. So I thought that was interesting when she mentioned that.
Why quarantine is so important, right? Because they can still slip through, and that's why we want to be very clear about how we're enforcing quarantine and how we're defining those who are essential workers that are given this restriction of movement privileges. But again, it's a mix of that, and we're continuing, and we're always having these ongoing conversations about how to tighten things up as necessary.
All right, thanks, Doc. Anything else you needed to let the community know about?
No, I just wanted to be sure that everybody knew about the vaccine opportunities, and that that we still have a lot more work to do here on Guam, especially those who are between 60 and 74 years old. There's only about 17% of you that have gotten your first vaccine, so we encourage you to make it out to these clinics and get your vaccine.
Mm-hmm. All right,
let's keep up the charge.
Yep. Well, let us know when we're ready to go over here.
Okay, we'll do.
All right, take care, Doc.
All right, thank you, everyone. Okay, bye.
All right, Doc. 7:22. Let's keep it in the KUAM News Zoom room. Welcome back, Sabrina. I was like, let me just sit back, and Sabrina's like, let's move along here and bring on Department of Youth Affairs Director Melanie Brennan, who has got a new hat to wear this morning. Was it, Bria, state of emergency was declared, was it Friday?
Yeah, late Friday, right before the 6 o'clock news.